This YCN segment is brought to you by Bubba's Bar and Grill on Lake Sunapee in Newberry Harbor.
Home Care Matters is presented by the Lake Sunapee Region VNA and Hospice.
Today on Home Care Matters, the JAMA report looks at decreased hospitalizations and costs for cancer patients in hospice care. I'm Jim Culhane. Lake Sunapee Region VNA and Hospice provides health care and hospice services, allowing continuity of care and helping people to stay in their homes as long as possible. To foster this mission, we provide the most up-to-date information about healthcare advancements, procedures, and products. In this vein, we present this edition of the JAMA report.
Barry Kahn was married to his wife Sandy for 34 years when she passed away from cancer.
She fought for 16 years. She had cancer for 16 years.
Barry says it took a while, but his wife was the one who decided to enter hospice care.
She became sort of joyous, really comfortable, and coming to terms with the idea that her life was ending. It's a welcome relief from the kind of care that you get in the hospital.
Dr. Ziad Obermeyer is an emergency medicine physician. He often treats patients with cancer who are at the end of their life, many times using invasive procedures such as breathing tubes and catheters inserted through the neck.
When we were putting in these lines and tubes and drains, it didn't seem like anyone was paying attention to the whole patient. What's important, what kind of values, and what kind of death that patient wanted to have.
So Dr. Obermeyer from Brigham and Women's Hospital and his co-authors looked at Medicare patients diagnosed with poor prognosis cancers in the last year of their life. They compared those who enrolled in hospice to those who did not and looked at the different kinds of care they received.
The people who didn't choose hospice had a very different pattern of care. They cycled in and out of hospitals and ICUs. They got a lot more procedures. And that care was largely targeting conditions that actually weren't to do with treating their cancer.
The study appears in JAMA, Journal of the American Medical Association. Barry says because of hospice, his wife was able to live fully during those final days.
The best thing for her was that she could be with her children in the most beautiful, natural way that she could be. At a certain point, you just have to realize that living is more important.
Catherine Dolph, the JAMA Report.
For more information about the services of Lake Sunapee Region VNA and Hospice, go to our website or give us a call. I'm Jim Culhane. See you next week for another Home Care Matters.